everybody. Thanks for coming back for season 3 of Colab Conversations. I'm so glad to have Robbie, Yuan, and Gordon with me today. Yuan did mention that World Cancer Day just passed, which was this past Tuesday. And I think the theme for that was everyone is unique. I'm opening up the floor to you guys.
Yeah, everyone is unique. That's a very good theme for me to talk about what I did. I did a thing on Tuesday. It was the launch of the Finish 8 campaign, which was a joint campaign by the Terry Fox Foundation and the Terry Fox Research Institute to recognize the work that the Marathon of Hope Cancer Centers Network has done so far and what we could do in the future. And Terry started the Marathon of Hope 45 years ago. And the Marathon of Hope Cancer Centers Network is going to take it on, and we're going to finish it. So I was downtown at the TIFF Lightbox for the launch, and I spoke as a patient partner on the need for more precision medicine, and it needs to be more equitable and more accessible. And the work that the Marathon of Hope Cancer Centers Network can really continue and really drive and accelerate this area, because everyone's cancer is unique and everyone's needs and requirements are unique, right? Like how we approach treatment is not because there's one standard of care for that person, but that standard of care also has to work for somebody's needs, somebody's priorities. Like some people would prioritize better quality of life versus toxic side effects, while others is like, look, I can tolerate side effects, but give me the strongest thing you got. So this is all really important and the promise of precision medicine is that this is where we're moving, and this is what we need to do. They asked me at the end, there were a ton of cameras in my face, and I was on CTV News actually, and Global. They asked me what my hope is for the future, and I said that my hope for the future is that we would have cancer managed like we see diabetes and hypertension. That cancer is no longer a scary word.
I think we've been discussing that about making cancer into a chronic illness, and for some patients that is kind of happening. But we're, again, like with precision medicine, as we discussed last time, we're still in the early kind of phases of this, because we know that there are people that are living with cancer that aren't NED or cancer free or whatever, remission, whatever word we want to use, but they're stable, and stable is often, a really important goal. Just keep everything at bay. So I think that's we need to have more discussion about that, where it's not just beating it and being cured and all of that. It's about extending survival, improving quality of life while you're living with cancer, and just my oncologist used to talk about it, extending the runway. Just and we also have this catchphrase KFG, right? Keep effing going, right? And it's like staying alive and letting the science continue to evolve. And even if a treatment isn't a curative treatment, it's a treatment that adds years to your life, and something else comes along the way. So I think that's really not talked about a lot, but should be as a goal. Cancer is a chronic illness. Sounds terrible, but it's actually a good thing. So that's also part of the language, right? Which we talked about a little bit last time.
Yeah, I saw your post, Ewan, and I thought it was really powerful, especially like that point that it should be like a chronic disease, or let's get to the point that it's not as scary and can be treated that way. Rethink Breast Cancer, who I do advocacy work with, has a Make Me Count campaign right now. And the point of it is related to breast cancer, but it is related also to lots of other cancers where you need more complete and accurate longitudinal data. One, because we currently don't know the amount of metastatic breast cancer patients that are in Canada, but two, if we're not properly measuring and collecting, how can we actually estimate and invest in precision oncology tools and long-term treatments for individuals? We don't know how long people are living with. We don't know if they're recurring or if they're diagnosed metastatic necessarily. And so hopefully we're on track to improving that, which will allow us to actually hopefully treat cancer in the long term, like a chronic illness potentially.
I
Yeah,
think
there
I
is
think
sorry.
the data is so crucial. Everyone for the last, I don't know how many decades, we talk about 5-year survivals, which is a very arbitrary statistic, because 5 years from when, and what does survival mean? And I find it's also could be very depressing as well. And out of date. A lot of times,
Well,
if
it's the
you
same thing of like survival in general too. Like I was looking at numbers of like your like estimated likelihood if you choose this treatment over this treatment of like dying from it doesn't change much, but it's like, well, you also have to look at like what's disease free. If I have a recurrence from making this choice and then have to spend another 2 years of my life undergoing treatment, like how is that not evaluated in these metrics?
I actually said that on Tuesday. I said surviving cancer is a lot more than having a pulse.
Mhm.
And I think it's pretty much time we really look at, say, some new measure where we look at adverse events versus
Yeah.
overall survival, like some kind of ratio. I don't know.
Hmm.
Someone with math has to like come up with a new better measure, because we're not talking about living at all costs here. We're talking about quality.
Yep.
And I
I
think I think
agree.
that kicks into another issue that's also important and not talked about enough. It's under the heading of wellness, right? But I know that when I was going through my treatments, we have a cancer wellness center near my home, and it's providing all of the other resources that you don't get out of your hospital. Um, Yoga and meditation, and maybe even a massage, maybe an art therapy, and it turns out also to be a place where people know that everyone has cancer, so you take that away, and often turns into like mini support sessions, because you're talking to people going through different phases of it. Now, this center is completely privately funded. They don't charge anything, and it relies completely on donations. So we have this like vast medical system, and we could probably talk for hours about all of the shortcomings. But here's like an element that is really, I think, missing out of um, cancer care, which is especially if it's going to be a chronic disease where you may be living with treatment for many, many years. You may be on treatment for some time, off treatment. You may go through periods of remission, periods of recurrence. Uh, where is the other piece that's helping the patient and also the caregiver, and maybe the family, and maybe there's young children? There's so much of your life that becomes consumed with this disease that needs to be taken care of. So I think like those are important things to talk about as well.
Yeah, we have something similar in Toronto called Wellspring. I don't know if you had been there or not. Similar, like it's available to all current and even former cancer patients and provides Reiki, nature walks, and whatnot. I think like it's really helpful and it's great for a lot of people. Like in my case, I went a little bit. I had a difficult time as like a younger person going through cancer because most people were not in the same generation as me and going through very particular challenges. I didn't feel like I had that community that I needed there, who are also like maybe single like I was, or going through onco fertility, like dealing with like very unique challenges that someone in their 30s or 20s would have gone through. So, but that conversation of like, well, if it's being treated at that, what does survivorship look like, or what does it look like to be living with cancer? And it's something that a lot of survivors and I, who I have connected with, talk about a lot. Like, there are challenges to survivorship afterwards. Like, you don't just like finish treatment and then you're done. Like, there's ongoing adjunct therapy, at least in my case, that like presents a whole other host of health challenges that like I might have forever. There's longer term health implications you have. And then there's the like, I don't want to say guilt because I feel like very privileged, but like not, it is a
It's
privilege like that I get to be in survivorship. So then you don't want to seem like you're complaining, or where, you know, there's an aspect of luck and like I get to be in the survivorship phase. So it's a hard thing to balance of like, yes, I, you know, have a hair Instagram account and there's whole challenges of like losing my hair and growing my hair back, but then it's also like I get to do those things, and that is part of that's a privilege. So it's a little bit, it's a challenge to strike the right balance when talking about these things.
it's very hard because friends and family will look at us and say, "You're fine. You look
Right.
fine. You look great." You know, and they
You
always want to
sound
say, "You look
fine.
great. You look great." But and I always say the sausage that comes out of the machine is not what went in, and you don't come out of this, however, whatever your experience is, whether it's months, years, it's a life-changing experience. And this part of this survivorship that's missing is these kind of discussions, because you touch on guilt and you're afraid to say it, because we know as advocates that a lot of the patients that reach out to us are often very, very sick when they come to us. And we know a lot of them are not going to make it. And it's really tough because now we feel like bad and empathetic and privileged, and we're in this weird psychological situation as advocates ourselves. So that's also something that we need, almost like a survivorship community to help ourselves through all of this, especially the younger you are, because God willing, we're going to live for a long time, but you're going to live with a lot of baggage. I think it's why we're all involved doing what we're doing. It's kind of I find it's kind of my therapy in a way. We survived, or we're alive for a reason, so we have to give back. We have to help others. It's kind of becomes imperative. So I think it's important to talk about it.
Yeah. If I can touch on the survivorship for a minute, because I feel like I started working in advocacy 11 years ago. And 11 years ago, we were just starting to talk about like what happens after your no evidence of disease or you're in remission. And we started to like talk about we needed survivorship plans. So once you're being followed by your oncologist every 6 months and then transitions into once a year, but then there's no communication with your primary care physician. There's no one who's really taking over that space. And so I think Europe has done a good job of addressing. I think ESMO does have like a guideline for survivorship. Canada obviously doesn't have anything. What would you like to see happen in this space? What conversations would you like to see happen?
Well, I think
What's
even
missing?
before we get to that stage, I had, and I sort of going a little bit back to what we talked about before, but I reached out to the wellness center and offered to volunteer as an advocate, and almost like just as a peer advocate. And the programming person was very much in favor of it, and then I got rejected. And so the first reaction was, well, we already have psychological counselors. I said, well, I'm not doing psychotherapy. That's not my job. And then they said, well, we can't give medical advice. I said, well, I'm not giving medical advice. So I'm there to help guide a patient, to empower them to obtain the medical and or psychological help that they need, and also a person with experience. And I think it goes together, because but there's no understanding even of that role, um, at least within that organization. I don't see it within the hospitals. And we're so short-staffed. I feel that, as part of survivorship discussion, opportunities for advocacy for survivors needs to be a component of that, and it allows us to also be involved, um, and keep in touch, let's say, with the science and with the institutions. And I don't, I know some of you guys are a little more actively involved, with organizations in wearing various hats, and I don't see it so much in the colorectal space right now. So that's a part, I guess, a little piece of the survivorship discussion maybe that should be uh, discussed and worked on. And I don't know, I'm not sure where to go with it, but maybe you have better ideas or experiences on that front.
I think we're starting to see a convergence of experiences here, right? We have one end with early stage cancers where you're expected to live longer, and on the other hand, where people with advanced cancers, it used to be like you're going to die anyway, and you're going to die pretty soon. Now we're converging, right? There are people on all spectrums now in terms of survivor, and survivorship as a concept needs to address this continuum, and it needs to address it from the aspect of quality from us as human beings, right? Like, we are defined by a lot more than our cancer. We are defined a lot more by the stage of our cancers and our expected survival, right? Like, we're here today and we want to live. And do we have the support systems for that? And right now, I think on both ends it's lacking. Like, I love my palliative care doctor, but not everybody has that. And I think it needs to be much more accessible. On the other hand, if you have earlier stage cancers, they don't prioritize any kind of survivorship. It's like, you're cured. There you go. Out you go. There's no trauma from being cured from cancer. Like, you're done. Go away. I think we need to start thinking about, once your life has been touched by cancer, it's changed forever. And we need to talk about that. Right? We need people to recognize that we're not back to normal. Like, remission? No.
Even the word palliative, you say that word and people run and hide. They think that's hospice and death. And palliative, all it means is making sure you're not in pain and you're comfortable. And I remember, they'll use a euphemism, the pain clinic. You need a referral to the pain clinic, but you walk in, it's palliative care, right? And so a lot of it keeps coming back to terminology, right? You're 100% right in what you said. I agree.
It's even more than that. My doctor referred me to a social worker, and she helped me walk me through forms, government forms, insurance forms. Like, you don't think of that coming from your palliative care doctor, right? Like, but financial matters weigh us down. It takes us away from focusing on our health. It's such a big deal of managing cancer, whether you're in curative treatments or advanced cancer treatments. But people don't have enough support for that, and that's such a huge aspect of it. My palliative care doctor has offered other things to address cognitive issues, for example, and it's not just pain management. And I've heard of one lady on my forum who actually said her her GP cancel her appointment with palliative care because he could help manage her pain. And I'm like, but it's a lot more than pain. It's a holistic view on you as a person. They center you as a human being. When you go to an oncologist, they center the cancer. You know what I mean?
Mm-hmm.
So like,
Oh yeah.
come
Yeah.
back to seeing us as people here. Like, I'm a human being first and foremost.
Yeah, I mean, that's also an interesting like segue into like how do we truly have person-centered care in oncology, because it is so piecemeal the way that we're treated. And the second they can boot you out of that care, you're booted out. Like to even get the proper follow-ups is like quite difficult. And you're given kind of all these drugs because that's like it's just a lot of prescribing and not necessarily like a holistic view of like managing the repercussions of those medications and what you're given. And so it is amazing to hear that there is one field, even though it's palliative and that word has a lot of other subtext and meaning, that like your experience with that type of doctor has been person-centered care. uh, Super important.
Robbie, can I ask you a question? Just because you're a little bit younger than the rest of us on the call. And so in Europe, there's the Right to Be Forgotten movement. And I'm just wondering, because there are a lot of young people who have cancer and then they no longer have cancer and they want to completely forget. And so, like, this
Yeah.
survivorship aspect is like irrelevant to them because it's done, they're moving on, they're gonna go start like the next chapter of their life, and whether that's getting married
Totally.
or having children or whatever it is, going to school, like they want to forget cancer.
Yeah, I mean, I would I wouldn't say like I'm feel grateful that I'm able to do a lot of work in the space and that it's given me a lot of purpose. But it's hard when your body has gone through so many changes. Like I I think there's a lot of people who can forget because they don't necessarily have like the longer term side effects or worries necessarily that they go through treatment, and they might not need like medication. Maybe they go through treatment and they don't need side effects, or they have surgery and that's it. And so it's easier to forget when it's not so physical. But like the at least for those of us going through breast cancer, it's like you have the mastectomy, so your body looks different. You lose your hair with chemo, so your hair looks different. You go through menopause, like the way your body functions, the way your body looks, like the way you feel every day. Then the side effects of like the joint pain, the muscle pain, like there's just so like the lack of sleep, like there's actually just so much stuff that is in this post survival or post treatment that I would love to forget it, but I don't feel well. So right? So, I mean, I wouldn't say I want to help people, so there's that. But like, it's hard to forget when there's just so much like stuff you're dealing with still, and so much worry and longer term worries that you have, and even just like. I'm trying to find more information on like menopause, and I'm listening to podcasts, and of course they're mostly targeted to like women who are in their 50s going through menopause, and they're talking about like just like bone loss and the fact that like if you're in your 60s and you're in menopause and you have a fall and you break your hip, you have a 30% chance of dying. Like that's insane. So then like now I have to worry about like my bone health and like am I at increased risk for like fractures and dying like at a younger age? And so it's like it's too hard to forget because there's so much to worry about. I would love that, right? I also get it. Like if I could, I probably would. Like I know lots of people who just like want to move on and don't want to be ingrained in, and I just don't see any other way because at this point there's so many people that um are challenging, have challenges in survivorship, have challenges like I face as a younger person going through it, and like can't even access the right screening like methodologies. Like, and I get messages like weekly from other people like directly in my network or through my Instagram of like them being given the wrong information and me telling them what to ask for. It's just like not clear. So it's
Yeah.
like a whole, yeah, it's hard to forget when it's like just
Yeah.
so infuriating at every step of the way.
But that sounds like the advice that you're giving people, who are DMing you on the social medias, it sounds like that would be the perfect place for people with lived experience to be in these wellness centers. But it seems like
Right.
they're not understanding that lived experience aspect. And I think we see it a lot across the healthcare continuum, is that there's not a full understanding of that lived experience and the benefit that that brings, because you're all experts in your disease area.
Yeah, and like in my case, um, I had multiple surgeries, including HIPEC. I was in a clinical trial. I took off-label treatment. I had chemo. I had immunotherapy. I had radiation. I have an ostomy. Um, I had remission periods, recurrence periods. I had bone mets. Like um, there's there's not tons of people that are alive that can say that, and it's
Mhm.
sometimes I don't even understand how I'm alive. But at the same time, I'm here with that experience, so um, it should be a resource. And everybody has their own angle of what their experience is, whether you're a younger person or whether you're on an experimental treatment, or you're not NED but you're stable and you've got a targeted treatment. We've all got like our own experience that's so valuable to patients and family. But it's difficult to find the spot within our system where that could be made available. I'm not a social media person. I'm not on Instagram or the other, social medias. And it seems like that's, if you're not there, you're not reaching people. So I'm glad to do these kind of
Yeah.
things, right?
I don't know that's true. I just think you'll have to find your own way to reach people. But like that's the only way I know how to reach my network, like broadly in my age group.
Right. No, and it's natural. I mean, that's
Yeah.
what you're comfortable with. Um, and I'm more I've done live conferences, and those are good because you can actually then chat with people afterwards. And there's not as much of that since COVID. Everything is online, and online is good because you can potentially reach a lot of people, and even
Mhm.
people don't have to tune in at a specific time. They can access it. Uh, I know the last podcast we did, I circulated it quite a bit, and it was very, very well received. So, like, yeah, I know we have to make the effort to find our our space, but at the same time, the system itself has to kind of start to open up and understand that there's, especially our system that is so depleted with healthcare workers who are overburdened. And
Yeah.
um, even an example like in colorectal, they usually give you a pivot nurse right away. And a pivot nurse is a nurse that stays with you throughout your surgeries and your treatments, even if your doctors might change. Um, and it was a huge resource for me. Now, the existing pivot nurse is so overwhelmed. We were trying to have a discussion. Wouldn't a patient advocate be like a good resource to know when to go to the pivot nurse? Or maybe you can direct someone for a second opinion, or help them even with the other resources, the psychosocial health and all of that stuff. But we're not yet. I don't know. There seems to be a reluctance institutionally to, and I don't know if it's liability that they're worried about. I'm not sure if it's bureaucracy that they're worried about. I don't know what it is that's holding it up. But like Robbie had made the point, and even in our wellness center, the rule is if you're a year past your treatment, you're graduated. And now what? So now I can't go and hang out at the wellness center anymore because I'm too good. I'm too healthy now for it. So there's a gap of what happens to the person now. I also had a situation where I had to go away for treatment. And then my local oncologist is like, okay, you're done with me.
Yeah,
So I don't even
I've
have
heard
a
that
local
happening.
oncologist anymore, right? So there's a lot of like actual real practical issues of survivorship that we have to navigate, and it's really we're relying on each other, right, to help ourselves, because there doesn't seem to be too much official programming or concepts of what to do.
I was just thinking, like, have you like approached like one of the advocacy groups, like a colorectal cancer Canada or CRAN, like to offer some sort of online support group, like
So
something
they
that's
do.
specific?
So they do. I mean, they do online support groups there. In touch with them, and I was trying to see if we could create something similar, but it's hard too because their resources are limited, and a lot of the advocacy that they're doing, which is really important, and I support it however I can, is to get drugs approved, because we're
Right.
still in colorectal, we're so far behind in drug approvals compared to breast cancer and lung cancer. And even now, like the treatment I received 5, 6 years ago just got approved in Europe, and they're trying now to get Health Canada approval. And we know even if Health Canada approves, hopefully they will, maybe this year, maybe next year, they still have to negotiate and get it covered by Medicare. And so a lot of that advocacy is centered on that level. Um, uh, uh, but yeah, I'm trying. It is one of the avenues that I'm trying to work on. Um, I think part of the issue with colorectal, and we've come a long way, is we're just coming from like nothing. It was considered an old man's disease, and so you got colon cancer when you're 78 years old, and nobody really cared about it. And it's hitting younger and younger people, and they don't know why. And especially women we know they get ignored by the healthcare system, and symptoms are not recognized. I just had a patient, he's in his young 50s, and he had colitis, so they ignored his symptoms for many, many years. Now he's got stage 4. So yeah, there's a lot of we're still like still building, I think, infrastructure at the colorectal stage, and I hope we'll get all of the elements there. But yeah, there's a lot of work to be done still. Trevor Maxwell, who's a colon cancer patient, and I sort of met him through Colon Town, which is a private group on Facebook. Now they're doing their own app off of Facebook. But so he created Man Up to Cancer, which was trying to open a space, because most of the discussion online in these Facebook groups is women patients or women caregivers, because the men just weren't into it or didn't find it like a space that they were comfortable. So he created this whole thing, which has actually grown quite significantly, and it captured a missing space in the cancer community. And I think this survivorship angle that we're talking about is another kind of space that should be growing, and I guess it starts with a few people, and see where we can take it, and just as a space to get together and talk about the issues that we can't talk about with anybody else. You can't, like, we're advocates, and we're dealing with sick patients. We can't complain to them that we're having survivorship issues. They're dreaming that they would be in our position. So where do we have the discussions about the challenges that we face, right? That's what I feel.
It's survivorship. It's such a big word when you think about it, and the the concepts that is encompassed in there is just it differs for different people, right? These are your experiences, and these are what you're struggling with right now. Um, I'm thinking, Gordon, what if like we start having like a sponsor type of a buddy type program where you have a friend to walk you through, a friend who's actually like, a couple of years after their diagnosis, who can kind of walk you through the initial stages. I know is very overwhelming in the beginning, and all I had were friends who did not have cancer, and I think they weren't even caregivers to somebody with cancer, so their experience was all very theoretical. And very scientific. They were trying to walk me through the science and the tests that I needed to do, but no one was equipped to deal with all the other emotions that I had. So I wish that right at the very beginning, your GP or whoever sees you first and says, here's a buddy you can talk to while you walk through this anxious-ridden, anxiety-ridden stage where you're just facing a diagnosis, you don't know what your treatment plan is, and they'll help navigate this for you, and they'll talk you off the ledge. Imagine how helpful that is, right? Like all the dark thoughts that swirl in us, we have no one to talk to, like our spouses, our partners, our family, like.
Right. I had that exact discussion with a patient about the darkness, because everybody wants to say, just keep positive, right? Just keep positive, right? We talk about this toxic positivity, right? And so I spoke to him privately, not with his, I was mostly dealing with his wife, who was, as a caregiver, trying to find him treatments. And I said, you've got to get the darkness out of your head. And the only way to get the darkness, because it's there, we all had it and we all have it. The only way to get it out is to talk to somebody about it, somebody that's not going to be freaked out when I had a moment. I remember I had a moment where they gave me so much Dilaudid for pain that I was like thinking, I wonder how many of these I would need to take to kill myself. I didn't go further, but you have those thoughts when you're going into those dark places, especially when you're going through chemo and you feel horrible. And yeah, I think you can't talk to your spouse about this, because they're already they're going through all kinds of difficulty trying to stay happy and smiley to you, so that to keep you going. So you need to have an outlet to go to those places and not be afraid to think, oh, I'm having really scary, dark thoughts in my brain right now. Maybe I want to be like that guy in that Billboard movie. It was Woody Harrelson, right? He killed himself because he didn't want his family to see him go through treatment, right? Now that's a movie, but you think about those things sometimes. So yeah, I think that's a really, really great point that you raise, to have a buddy, to be able to talk, somebody who isn't going to be freaked out listening to that darkness. And then it helps so much as an outlet, just to be able to express it. I think that's like, you don't hear about any of that anywhere other than these kind of discussions with patients and survivors. Really great point you made.
For sure. That matchmaking is tough though, right? It's like you're at particular phases. You don't know how long your treatment's going to be. You don't know what you're going to go through. So that is like, I can see how that's also a challenge. I connected with like so many people, and the ones that I ended up being closer with, they either had the EQ to kind of like spoon feed me things as I need to know, or there's kind of parallels between where we were in our lives and an emotional connection. And so there's also kind of that emotional side of like having a click or some sort of like synergy between the person, because not everyone's gonna meet the other people where they're at. It's a challenge for sure.
Yeah. What's happening now is that it's rather organic. We're finding our own friends, and
Yeah.
if you gel together, then you hang out together and you talk to each other. I don't know, like I'm not sure if a formal system, like Robbie said, is effective. It's almost like we need to create opportunities where people can meet each other. And oh my goodness, this sounds like a dating thing now. But maybe it is a dating thing. It's dating for your cancer buddy, and finding out that they're, personalities that work well together. But you have to meet a lot of people to find that. Maybe that's where we're going in this.
But we have to be careful too, because you can't get too close sometimes, because if we're going to get emotionally involved on that level, and we know the outcome may not be great, or we know that certainly it's going to be rough going with surgery and treatment and everything else. So it's also, like you had mentioned, uh, the oncologist sometimes looks at us as like a slab of meat, where that has to be, this drug and that cut here and put that drug in, but also they have to protect themselves from, all the patients that they're going to lose along their career. We have to be a little careful for ourselves as well, not to. And it's hard, because I'll have patients that I talk to and they go off and I don't know what happens, right? And you don't want to start, looking them up later and finding out if they passed away or didn't. Like, it's just, that kind of stuff is like difficult too. So yeah, I don't know where it all meshes out, but I do think that, especially in our system, because it's requires so much self-advocacy just to move forward, that at a minimum, just having somebody that's been through the system, even if you don't know all the specifics and all the treatments, but just kind of know uh, a little bit about how the system works, or like silly things like I was saying, get to know the oncologist secretary, buy her a Valentine's gift or something. The secretary is the person that's going to be your best friend in the hospital. And if you need a record, instead of going to medical records and waiting for 3 weeks for your file, you can go, can you print out my clinician notes? Because you're going for a second opinion. Like little help like that people don't have, that we learned along the way, I think would be very beneficial.
It
For
sounds like
sure.
that. Go ahead,
Yeah.
Yuan.
Yeah.
I found, rather than DMs, forums where you're essentially crowdsourcing, but you have to put yourself out there. You have to be vulnerable, and talking about what you need. But essentially, the answers and the support there is crowdsource. And you, as a participant responding to other people's questions, you also have the option of taking a break from it and then taking one step back and said, I'm not going to engage with this person because I've seen them not react very positively, or this one person really enjoys feedback, and so you have the option of diving in deeper, or taking a little bit more detached approach to what's going on there, or just lurking around and just listening to others, and seeking comfort in that, not really participating but listening. So I think maybe in a crowded room it might also help versus a buddy system. But all in all, I think we all struggle with support systems and trying to find that middle ground where we're not burning ourselves up trying to help others, where we're trying to figure out how to get help ourselves. So it's a hard balance to achieve, and it's really a tenuous balance. Even if you find a balance today, something can set you off tomorrow, right? An anniversary, somebody's birthday, your birthday, a milestone in your life, a new pain that you find. So you always have to think about this. This balance can change, and try to find a balance for yourself, and then you can help others. Oxygen, it's like that oxygen mask in the airplane.
Maybe
And
this podcast is where you start. And like you're having these conversations and you're coming from different walks of life and you're coming together here and you're having this conversation like where you have these commonalities through your experiences. And so maybe this is like a place where we can start and we can invite people to comment and ask their questions and like, what would you like to ask Gordon or Robbie or Yuan? And like, what would you like the next topic discussion to be? And I'm just throwing it out there, but maybe this is a place where we can do a soft launch.
I mean, I think an interesting, like we've talked about it a bit, but like actually doing a deeper dive into like what are the fundamentals to building your support system during cancer care and doing a deep dive specifically into that would be like a good topic, because that looks different for everyone. It's not cookie cutter. And if it was, then there would be more solutions that existed to actually address that. But I think that could be an interesting topic and certainly like really helpful for people going through it with all different types of cancer, all different ages, all different situations.
Yeah. And maybe we can open it up to like, it won't just be us recording and then putting it out. We could do like a live discussion. If you're
I mean,
up to it. I'm
you're
just
the
throwing it out
architect,
there.
Sabrina.
No, I'm just
You
throwing
tell
things
us. We
out
show
there.
up. We show up. You tell us.
Mhm.
Well,
Yeah,
I'm
no.
working based off of you guys, so I mean, I think that could really be an interesting discussion if you're all.
Yeah. I mean, it's a different audience, and
Yeah,
yeah,
there is an
yeah.
audience.
Yeah.
Yeah, I mean, if I did CRI used to do in-person patient conferences. So I did one of those. It was patient conference. So they had doctors and they had patients on the different panels, and but the audience were patients and caregivers, and it sparked a lot of great questions from the audience. Then when COVID hit, they for a time did um, a live I guess it was a conference, and they split it up. So they had different blocks of specialists, and then they had the patient panel. We went live, and there were like 7,000 people that had tuned in, and we got live feedback from them and questions, and it was really good. And then they post it later on YouTube or wherever. I think that would be a good thing, and I like the topic. I think that's kind of a common need for anybody going through this, and it's not just the patient, the caregivers also. Who's going to support the caregiver who's afraid of losing a loved one and trying to be a cheerleader at the same time and running around doing the advocacy? Like, that's a whole other thing that you might want to look into, not necessarily with the three of us, but I think it's something that is also not talked about enough. There's some discussion now about it, but it needs to be talked about more.
Yeah, absolutely. Especially in therapies where you actually need to have a caregiver in order to receive the therapy.
And while we're talking about support systems and groups, now that we know that cancer is hitting younger and younger people, talking to children is going to be a pretty big topic too. I think many of us struggle with that, especially with younger children. Putting
And
it
is
out
it
there.
learning to talk to children about a parent or a loved one getting cancer?
Yeah, absolutely.
I mean, I think you also need to learn to speak to children who have a sibling who is being diagnosed with cancer as well. And it's a completely different conversation.
Yeah, or a friend or
Yeah.
a family, close peer type of situation. I think that is a topic that we don't usually touch on. Children are a lot more savvy and they're much more perceptive of their surroundings than we credit them for. So
Mhm.
when we try to hide things from them, we're not doing them any credit, right? So it just adds to anxiety because of all the questions that are no one wants to answer for them. It's like they all just kind of ignore it and just this big elephant in a room, and everyone's like trying to be normal around the children. It doesn't work.
Yeah,
By
it's
the
a
way,
hard thing too, because
mhm,
I have a 7-year-old nephew who would have been, I guess, 5 at the time that my sister was diagnosed, and then I was shortly thereafter. My sister is a teacher, so she's used to being around kids and did speak to a social worker on how to explain the cancer to my nephew. And one of the big things was like, is it contagious? And of course, said no, it's not contagious. But then like a month later, I got diagnosed with breast cancer. And so of course, like it wasn't contagious, but then that's another thing to like a layered add on. Well,
yeah,
why does Auntie Robbie have
yeah,
it too if it's not contagious to a 5-year-old who was on the cusp of being 6? And he took everything like pretty well, but we like put off until we had to telling him. I think even with my surgeries, it was sort of just didn't say that. And then like I went through chemo and lost my hair, and he just seen like his mom lose her hair. And so I think, I don't even know if we mentioned that much. It was just like but he knew. It was like, oh, is Auntie Robbie getting chemo?
mm.
And so
And you know
like
what?
he took everything well, and it was explained to
But
him, but it's like he's a kid.
yeah,
That's a hard thing.
but for a young relative, the difference between contagious and genetic is not really a difference, right?
Right.
Mhm.
Hmm.
Like he maybe he used the word contagious, but what he's saying is, am I going to get it? Or like, you know,
Right. It's scary.
so it's very scary. Yeah.
All right, so I'm going to give you each some time to finish off. And since we focus most of our conversation on survivorship, maybe just like a takeaway on survivorship.
I think we just need to keep having these conversations. Talk it out.
Yeah,
Ditto.
I think uh, the more of us, and it would be great to expand the group. The more of these conversations that we have amongst ourselves, and then getting it out into the world, I think is really good and important. And I think that little by little that could really start to we always talk about awareness as advocates, and this type of awareness I think is really important and beneficial.
I think I can add, oh, it's a long one. So last year, the Marathon of Hope Cancer Centers Network had a grant application called the Patient Voices in Research, which is patient defined, patient prioritized, patient adjudicated, and the 10 projects totaling $1.8 million was awarded right before the new year, around December. And one of the themes in there was survivorship. And I still recall back in the summer during one of these workshops and fleshing out these themes, I brought up the concept is like, well, now that so many of us are on therapies where we're treating it like it's chronic cancer, we have survivorship now in the context of living with metastatic cancer. Can we also add that as one of the bullet points under the theme of survivorship? And they're like, yeah, let's do that. Happy to announce that we have at least one project awarded that addresses survivorship in the context of metastatic cancer. And I think we're starting to have those conversations, right? Like we don't have enough survivorship conversations for early stage cancers. Like no way, there's just not enough support there. The end. But we're also now starting to have conversations, just like palliative care is not scary, that everybody needs to think about that. We're starting to think about what survivorship means for everyone touched by cancer. Like let's just have this big Venn diagram for everybody and not just have like a limited scope here. It's
It's
everybody touched
amazing.
by cancer. Yeah.
Yeah, that's awesome. That's really, really good to hear. So you're already moving the needle for us.
All right. Well, thank you again so much for your time, Robbie, Yuan, and Gordon. Obviously, not the last conversation we're going to have on this topic, and maybe the start of a lot more conversations on this topic. But thank you. And I am obviously, as always, looking forward to having more conversations with the three of you because I find all three of you super enlightening and engaging, and I love these conversations.